The 39-year-old suspect in what was a harrowing moment for Atlanta. Gwinnett County transit bus with passengers on board making its way very aggressively and erratically on I-85 in the middle of rush hour traffic, causing quite a panic for motorists on the road, leading to a multi-county chase with authorities. We are learning the details of who the suspect in this incident was, as well as the aftermath and the victims. Thank you for joining us here on Atlanta News First. I am Maria Moreau. We're going to get into more of what we're learning minute by minute about this bus hijacking, and talking about the suspect in particular, Joseph Grier, who you see here on the left-hand side, his mugshot, and on the right-hand side, what was an interview he did on camera as a witness to another shooting that took place prior to the hijacking incident. Now, this interview was along Peachtree Center in downtown Atlanta, where he spoke about witnessing this shooting, and also, interestingly, mentioned that he had bipolar disorder, and he said that he hadn't had his medication, but that, quote, Grady was going to get him some. And we want to talk more about that particular statement. Now, I want to be very clear. We, at this point, do not know if his condition played any part in the incident that took place involving the bus hijacking. I also don't want to take away from the fact that this was a deadly incident, one that traumatized several people and left a family heartbroken at the loss of a loved one, friends that are waking up every day and just trying to wrap their heads around it. But I do want to talk about the greater conversation around mental health care in Georgia. And to help me talk about that is Dr. Rickers, a behavioral health psychiatrist. Dr. Rickers, can you hear us all right?
I can.
Thank you so much for joining us here on Atlanta News First. I know that you are not a psychiatrist that can speak on this individual, the suspect in this bus hijacking case. That will come out later through medical records and any information we learn about that way. But I did want to bring you on to talk about the bigger conversation, the better understanding of mental health care, how it exists in our society, and specifically bipolar disorder. This is a heavily stigmatized condition that many live with and function with successfully. So for those that are hearing about this for this first time and really learning about this condition or hearing about it, what is bipolar disorder?
Well, Mariah, that's a big question. I don't know that I'll be able to cover it all, but bipolar disorder is a thought disorder that is related to depression because it has some of the classic symptoms of depression. But what happens with people who have bipolar disorder is that they have periods of elevated mood that look distinctly different from the depressive episodes. These episodes typically involved lack of sleep, impulsive behaviors, talking very fast. Sometimes people will become delusional or psychotic in the manic state. People who become manic will often spend a lot of money, will become hypersexual, and it can be a very severe condition requiring inpatient hospitalization and medications for the patient's own safety. As with almost any of these conditions, these mental health conditions, it's a spectrum, right? So some have more severe symptoms, some have less severe symptoms. There's numerous types of bipolar disorder, bipolar 1, which is the most severe, bipolar 2, which is less severe, cyclothymia, which has less depression and more mania. And it's a very complex condition, but when it is severe, it can be dangerous for the individual because they don't have control over some of their actions. They are not thinking correctly, and they may be delusional and psychotic.
Doctor, I often hear that anxiety and depression is easier for folks to digest when we talk about mental health care, and there is a lot on the spectrum of mental health. Bipolar disorder is one that often you hear about it and has a negative connotation, and it is not necessarily a negative thing. There are folks that live among us that we don't know are struggling with bipolar disorder, and they are medicated or they're, self-healing and they're operating and aware. I just want to speak on the stigma around this condition. Why do you think this condition in particular has such a negative stigma?
Well, likely because it can have pretty severe symptoms and severe consequences. Depression oftentimes is severe, yes, of course, but bipolar, and then these episodes of elevated mood, potential psychosis, lack of sleep. The stigma is likely due to people's misunderstanding of it. Folks with bipolar disorder have made some of the greatest advances in this world. Some people would argue we all have bipolar disorder. It's just how often and how severe our mood swings. With treatment, with sobriety, with social rhythm therapy, you can treat it, you can manage it, you can be very successful with bipolar disorder. But as a society, we look on that negatively, like we might look on someone with schizophrenia, as opposed to somebody who has depression or anxiety. Bipolar disorder only affects about 3% of people per year, maybe 5% of people in their lifetime, whereas depression is much more common. Anxiety is much more common. Almost half of us probably have anxiety of some sort. So we can digest that. We understand that. But bipolar is something we don't understand, and we tend to fear things that we don't understand. We tend to stigmatize things we don't understand. And if we could help people understand it, get the treatment they need for it, and not be treated differently because of it, it would be better for all of us in society, and certainly better for people who are worried to get treatment because they're worried they might be stigmatized or labeled because of it. So anything we can do to break down the barriers to treatment are going to help all of us.
I wanted to emphasize, we are having this broader conversation that is sparked by a commentary regarding a recent incident, the one I just mentioned. But it led to a lot of people asking, why weren't the signs caught? And I feel like a lot of that is due to the inequity in mental health care and medical care. This alleged hijacking bus suspect that said he had bipolar disorder. His father, also said he had bipolar disorder and said that he was not medicated but was going to get his medication. Why do you think there is an inequity with medical care and mental health care?
Well, generally, healthcare has some inequities based on socioeconomic issues. And getting the treatment, getting the proper medications is a challenge if you don't have the insurance, if you don't have the resources in order to get the treatment that you need. It's not always just medications. Sometimes the psychotherapy can be very helpful as well. But for people who have certain types of insurance or who are underinsured or no insurance at all, there's very few resources. The counties, the state, they have some resources, but they're limited. There's not a lot of resources that are available to most people. If you have the resources, the medications become more available. There's also stigma in different populations, and for some people, they maybe don't want to talk about their mental health issues because that's not what their family does, or that's not what their uh, um, that's not what their community really engages in, is open discussions about mental health, which is a barrier we're trying to break down. We want people to get help. We want people to have access to these medications, but it is a challenge. And if people don't speak up about what they're going through, it's hard to get the treatment. Also, even as psychiatrists, sometimes we miss bipolar disorder. If you don't catch someone in a manic episode, sometimes you may not notice the symptoms. And so it's difficult to diagnose even for the trained eye, much less someone who is not trained, and they're wondering why their loved ones or wondering why they may be having these mood cycles.
And you have such a valuable perspective, not only as someone who has studied this condition, many other psychological conditions, but also have exposure and interactions with individuals that live every day with these conditions. I feel like a lot of it is, like you said, lack of understanding, a lack of exposure to what this condition is and isn't. For those that are trying to, be a better support system for their friends, for their loved ones who might be dealing with a condition like bipolar disorder, what are some ways that they can be a stronger support system?
To help the patient to get the help they need. Um, in Georgia, there are laws if somebody is dangerous, if they're engaging in dangerous behaviors, danger to themselves, danger to others, that with a physician and family, you can get someone treatment even if they don't want treatment. Part of the problem is that when people get into this manic state, they tend to feel pretty good. They're having so much energy and they're talking so fast and they feel so smart that they don't want anybody to intervene or take that away. But if it continues, then it leads to things like potential psychosis. You could become bankrupt from the excessive spending. You can lose relationships. And so, if you have a loved one who's experiencing bipolar disorder, try to get them help. Try to get them involved with either if they're underinsured, try and get them involved with the county in some way. If they have insurance, get them involved with a psychiatrist or a doctor. If they're in acute state, try and get them to inpatient care so they can receive immediate and aggressive treatment. If they're not willing to get treatment, you can coordinate with the authorities to try and get somebody who might be a danger to themselves or others the treatment they desperately need. So that can all be helpful. We also have these long-term injectable medications so that people with bipolar disorder sometimes struggle to take their medications. But with the long-term injectables, you can get a shot every month. That keeps you from having manic episodes, keeps you from becoming psychotic. So there's a lot of treatments available. It's just a matter of getting people to the right provider so they can get the help they need. So there's resources out there. You can find those resources on your county website. You can work with authorities if there's a dangerous situation. If they already have established providers, giving information to those providers, especially if those providers haven't seen this manic episode yet. Maybe they don't even know the patient has bipolar disorder.
And I'm hoping I can ask you this from an industry perspective. We often hear the word "this could have been prevented if someone just knew how to help." Are there any frustrations within your professional industry about the state of mental health care and medical care that is currently being offered to patients? If there are any shortcomings and room for improvement, I'm sure there are.
Certainly, there's room for improvement. We need more doctors. We don't have enough psychiatrists in the country. We're short on therapists. There's not, very many places treating such things. We have a clinic there in Atlanta that does partial hospitalization, and that can be helpful for people. But if you're underinsured or you don't have insurance, our clinic would have to be like through our charity program. So, it's hard to get people treatment because the treatment is expensive. And if you don't have insurance, if you don't have the funds, then sometimes people will shy away from that treatment. But there are county options, there are options for the underinsured. And having a thought disorder like this makes it more difficult for people to maintain employment, insurance, and these type of things. So that's where the counties can become very helpful. But my hope is that we can improve the overall infrastructure of mental health in the country, opening more partial programs like we're doing around the country, getting more doctors trained, more incentives to go into psychiatry, bringing more nurse practitioners in to provide medications for people, getting more therapists to give the therapy, and then the social supports become really important as well. So we need more. We're desperate for it. Mental health is going up and the number of providers is going down. And there's a lot of psychiatrists retiring in the next 10 years. We need more. We need more. So whatever we can do as a society to fund mental illness treatment and to encourage the education for mental health, I think will be very helpful for us as a society.
I really appreciate the way that you worded that. Any final words, as we follow this story and we talk about mental health as just a broad picture, and you put it so well, we just need more help, more awareness, and more understanding of this.
My final word would probably be this: bipolar disorder is a treatable condition. If you get treatment, you can manage it. You can have a very normal life. You can be successful. You can do the things that you want in life. Don't ignore it. Get treatment. Get yourself help. Get your family help if they need help. Don't just assume it's going to go away. And don't stigmatize people who have mental illness, especially bipolar disorder. Oftentimes, they may not be in the right state of mind because they're manic, because of their mental illness, and not necessarily because they're choosing to be that way. It's a biochemical problem. So get help, get treatment. If you know somebody who needs a treatment, get them the treatment, and hopefully we can treat more people as we get more resources out there.
I really appreciate all of your insight, all of your perspective, and having this conversation with me. We are going to have this full interview for you online on AtlantaNewsFirst.com. Dr. Tyler Rickers, thank you so much. Any way that folks can connect with you if they are looking to talk to you more about maybe their mental health needs or learn more about what you do?
If you go to our website, Rogers Behavioral Health, it'll take you to a number of resources that can be very helpful. There's both educational resources, referral resources. We have programs in numerous states and numerous levels of care. And so if you go to our website, it should connect you with a lot of information. And if you need to get some help, it'll give you some resources.
Well, I really appreciate it. Thank you so much for joining us on Atlanta News First Plus. We're going to get you back to your regularly